Good morning. Thank you for the opportunity to speak with you today. My name is Alexis Ferguson, and I am mom, communication and regulation partner, and advocate for my son, Colt, who is an amazing 6-year-old that has taught my husband and I so much in these short 6 years. He is also profoundly disabled by autism and cannot speak, but he can communicate through spelling on a letterboard. I am also here to introduce you to some amazing parents and advocates for their children as well. This is Courtney, mom of Kennedy. This is Nayar, mom of Christian and Jose. This is Danielle, mom of Melody. And this is Wayne, dad of Emily. We are here today to give our testimonies regarding the crisis of healthcare for hardworking families with children with disabilities. To date, there are still over 25,000 people on the pre-enrollment wait list for MediWaiver. Given that it can take 7 or more years before receiving services, hardworking middle-income families like my own can fall behind despite doing everything right, simply because we make too much money for traditional Medicaid, but not enough to afford the astronomical treatment costs associated with the level of care that our children require. I am also a public school teacher. This past year, I was faced with the fact that through my insurance, that my son's therapies would be capped at $35,000 a year and $200,000 for his lifetime. I spent the greater part of a year speaking at school board meetings, sitting on bargaining meetings, and praying for an agreement on no longer capping therapies regarding autism for public school teachers and many other state agencies with self-pay private insurance, while all the while paying out of pocket for large amounts of co-pays, co-insurance, deductibles, and premiums. This in return almost bankrupted our family. During this time, we applied for waiver services through APD via crisis, only to be met with countless hoops to jump through or just not getting responses at all from APD. Despite meeting multiple points for crisis, we did not receive services until over a year later. This is unacceptable. My husband and I have watched our income, savings, and hope depleted just trying to maintain basic needs such as therapies, medical equipment, doctor visits, all while just trying to keep food on the table. There should be a way to help those of us with children with profound disabilities who are doing everything we can to provide a better life for our kids and are still falling behind because of catastrophic circumstances we didn't ask for, but we have embraced. With our proposal of Bridges of Hope, this will allow parents to provide care for their disabled children while remaining above the poverty line and off of welfare. This program would stabilize the family unit for people in tragic situations by allowing them to continue to be productive citizens, thus strengthening our communities, our state, and even our nation. Thank you for your time. I'm going to give it over to my partner here, Courtney.
Good morning. I am Courtney Nina, a mother of 4, Joshua, Nicholas, Kennedy, and Noah. My youngest daughter, 6-year-old Kennedy, was diagnosed with epilepsy and other developmental delays. Our journey began when she was only 7 months old. I served as an effective public servant for over 15 years in Hillsborough County's public schools. Due to my daughter's extensive medical conditions, I resigned from teaching and became her full-time caregiver. This decision impacted our family emotionally and financially. Now, my family of 6 needed to financially survive and thrive solely on my husband's income. My daughter needed physical therapy, occupational therapy, speech, and an abundance of doctor appointment visits. All of these weekly appointments were very costly. We researched alternative insurance plans and qualified for Florida Kid Care, Children's Medical Services, CMS, under Title 21. We pay an affordable monthly fee, and Kennedy has access to unlimited therapy visits, doctor appointments, and many other medical benefits. Between the cost of living and my student loans, I don't know how we would have managed to tackle Kennedy's medical needs without having this medical insurance plan. One major drawback to this plan is that it has a substantial low-income-based restriction. My husband and I are both college graduates, and we are now living from paycheck to paycheck without any way to supplement income if we want our daughter to remain on this specialized plan. If I return to teaching in a public school setting, one of my biweekly paychecks would not be enough to cover my daughter's monthly therapy expenses. Ultimately, I would be working just to pay her medical bills. Kennedy will probably need these services for the rest of her life. I couldn't imagine how her quality of life would be if she didn't have a plan like this. Currently in our state, there are 4 insurance options available for Florida residents under the Florida Kid Care. This includes Medicaid, MediKids, Florida Healthy Kids, and the Children's Medical Services Managed Care Plan. The plans were designed for children residing in Florida from birth through age 18. There is no application fee, and there is only one application needed per family. The program's criteria are based on the age of the children, household size, and family income. Florida Kid Care includes free, subsidized, and full pay options based on family income, with the exception on the plan geared for children with disabilities. The MediKids plan covers children ages 1 to 4. Florida Healthy Kids plan covers children ages 5 to 18. Both plans include free, subsidized, and full pay options. Currently, the only plan established for children with disabilities is CMS, and it does not have a full pay option. We are kindly asking you all to consider having a buy-in medical plan that allows more Florida families with children with disabilities to benefit from this type of coverage and increase the financial income requirements. Thank you. Now you will hear from my fellow partner, Nayar, who will explore more information about health care.
Good morning, everyone. Thank you for being here today. My name is Nayar Arzuaga, and I'm the proud mom of Jose and Christian, 2 amazing, exceptional boys, ages 11 and 6 years old, with autism and other developmental disabilities. Let me briefly share an episode of my personal story with you. When my children were diagnosed, I was told that the only possible effective treatment would be therapies, especially applied behavioral analysis therapies, also known as ABA. Okay. However, since we had private insurance through my employer, which didn't cover ABA services, and my household was not eligible neither for Medicaid nor any other government-subsidized healthcare plans, my children couldn't access the early interventions that they desperately needed. Due to my children's needs and daily challenges that come with developmental disabilities, I had to quit my job, where I had been for more than 11 years, jeopardizing my family's financial security and sacrificing my professional career. I went from being a productive, tax-paying citizen to someone that was only able to generate small or no income. None of this would happen if we here in Florida had a buy-in Medicaid healthcare plan option, as it exists in other states. For example, in Colorado. They come with the Health First Colorado buy-in program for children with disabilities. This program allows families who don't qualify for the regular Medicaid, right, to access to the buy-in option, paying an affordable, and I insist, an affordable monthly premium. That monthly premium is based on the family's income, and gross family income must be below the 300% of the federal poverty level. Let's remember that here in Florida is 200%, okay? For example, and based in Colorado Health Department data, a family of 4 earning around $10,000 per month may qualify and would have to pay from $90 to $120 as monthly premium only. We are not asking for something extraordinary, not unfeasible. We are just asking for the possibility of seeing our children flourish and becoming their best versions as adults after receiving the early interventions and services that they need now to be successful citizens. It is an investment in our future, and it is, without doubt, worth it. Thank you, policymakers and fellow partners, for your support. Now my colleague Danielle will continue.
Good morning. I stand before you not just as a mother, but as a voice for countless parents who, like me, navigate the challenging journey of raising children with disabilities. My name is Danielle Leis. I'm a proud mother to a beautiful, sassy 12-year-old daughter named Melody Baptiste. She is diagnosed with cerebral palsy and intellectual disability. I'm also a proud aunt to a very funny, awesome nephew named Antonio Diaz. He is 18 years old and diagnosed with cerebral palsy and intellectual disability. I'm here to shed light on the pressing need for a comprehensive buy-in healthcare support option, particularly in terms of intervention and how to generate savings to the state of Florida. Let us all agree on one fundamental truth. Intervention is not a luxury. It is a necessity. Back in 1986, Congress recognized this urgency and established Part C of the IDEA law to address the developmental needs of infants and toddlers with disabilities. The primary goals were clear. It was to enhance development, reduce educational costs, prevent institutionalizations, and maximize independent living. So we need to recognize that the financial impact of intervention extends into the future. An individual who received speech therapy as a child will be able to communicate and have a job when they become adults. Therefore, by providing adequate support until the age of 18, we can realize substantial cost savings for the state. This includes minimizing expenses related to assisted living, nursing care, ABA therapy, job coaching support, and continuous living skills support. Without proper intervention, individuals may become wards of the state, adding to the financial strain to the state of Florida. As responsible citizens, it is our duty to ensure a financially sustainable future to our state and for our children. Vocational rehab spent approximately $8.7 million and employees under the supported employment services, as well as spending $3 million on customized employment services plan. So these are just specific positions for a vocational rehab employee. So again, this is costing our state because they had to hire one person, like at least 3 to 4 people to support one individual. So again, this highlights the significant costs associated with assisting individuals who lack the basic executive functioning skills taught through ABA therapy, behavioral therapy, speech therapy, occupational therapy. So I implore you to consider the broader implications of our actions today. Currently, Florida has 25,000 disabled people in a waiting list, with an estimate of some of them dying before even receiving services. These are 25,000 people that will cost money, and instead they could have had a job, they could have had a house and a life. So we must prioritize comprehensive health care that includes an intervention for our children with disabilities. It is not just a matter of compassion, it is a matter of fiscal responsibility. By investing in the well-being and development of our children now, we pave the way for a more economically stable future for our great state of Florida by ensuring our children can grow into productive, tax-paying citizens of Florida. Thank you.
Ladies and gentlemen, esteemed policymakers, partners, and fellow advocates, my name is Wayne Cordova. I'm a husband, father, nonprofit leader, and future graduate of Partners in Policymaking. I stand before you as a voice for thousands of families across Florida, families entangled in a challenging system that is failing our children with developmental disabilities. Currently, there are 25,000 individuals on the Meta waiver, over 25,000 here in Florida, with some enduring waits of up to 16 years for essential services. Among these families is mine. My daughter, Emily, is 13 years old. She has hypotonic cerebral palsy and Lennox-Gastaut syndrome. She's more than a statistic on the list. She's a vibrant 13-year-old girl with dreams, passions, and interests, and a life to live to the fullest. But our story is not unique. Many families who do not meet the stringent income requirements for Medicaid or CMS are struggling. They are trapped between the need to provide for our children and the limitations of private and employer-supported insurances that cap essential therapies and exclude vital equipment and supplies. This harsh reality also applies to Florida Healthy Kids and other state options, leaving us in a continuous battle for survival and dignity. The Bridges of Hope initiative seeks to change this narrative. We propose a Florida state Medicaid buy-in option for children with developmental disabilities. This initiative aims to offer a lifeline to families that are working, allowing them to be productive citizens while providing the necessary medical support for their children. We're advocating for a system where families earning up to 400% of the federal poverty level can secure appropriate medical coverage for their children aged 3 to 18 who, while eligible for Florida Med Waiver, are languishing on waiting lists. Imagine the impact of this initiative. It's not just about medical coverage, it's about enabling families like mine to afford reliable transportation, to make necessary home accommodations, and to ensure a secure future for our loved ones. As we run a nonprofit, our family, to support other families affected by disability, our income is limited. The current income thresholds of CMS restrict our ability to provide for Emily's needs adequately. Bridges of Hope is not just a program, it's a fundamental right for hardworking Americans like us to afford our basic needs while ensuring our children receive the care they deserve. So I call upon you, our esteemed policymakers and community leaders, to stand with us. This is our chance to make a tangible, life-changing difference. Support the Bridges of Hope initiative. It's time to transform our system into one that uplifts, supports, and empowers every family and every child with developmental disabilities. Together, let's build these bridges, not just for Emily, Colton, Melody, Antonio, Kennedy, Jose, and Christian. Not just for the 25,000 waiting, but for every child who deserves a chance to thrive in a society that values their well-being and their potential. Thank you.